Have you ever wondered why your legs might feel weaker after 60, even though you try to stay active and eat well? It might surprise you to know that some of the vitamins you take every day, hoping to boost your health, could actually be working against your leg strength. That's right, those colorful little pills in your cabinet may not always be as helpful as they seem. In fact, some of them, when taken in the wrong amounts, can quietly drain your energy, disturb your nerves, and even make walking or climbing stairs more difficult. This is not to scare you, but to inform you, because knowledge is power, and taking the right steps today could mean stronger legs and better mobility tomorrow. Welcome to this eye-opening educational video, where we will dive deep into the world of vitamins, and how they can affect your leg strength after the age of 60. You will learn how certain deficiencies can lead to weakness, how excess doses can disturb your muscles, and how even common multivitamins can sometimes cause more harm than good. This video is not medical advice, and we are not here to tell you to stop your supplements. Instead, we want to help you understand what might be going on inside your body, so you can have more informed conversations with your doctor or healthcare provider. So if your legs have been feeling tired, shaky, or just not as strong as they used to be, and you're wondering if your daily vitamins could be part of the problem, you are in the right place. Stick with us, as we uncover the hidden connection between vitamins and leg weakness in older adults. By the end of this video, you'll have a clearer picture of what to watch out for, what to discuss with your doctor, and how to support your legs with the right nutrients, in the right amounts. Let's get started. 1. Vitamin A, excessive intake. Vitamin A is essential for vision, immunity, and skin health, but after the age of 60, taking too much of it can lead to harmful effects, especially for the muscles and bones in your legs. When vitamin A levels are too high in the body, it can create a condition known as hypervitaminosis A. This condition is toxic and can damage various organs, but one of the most affected areas is the skeletal and muscular system. Older adults are more vulnerable to this toxicity because their bodies process vitamins more slowly, and long-term supplement use can build up dangerous levels without obvious warning signs. One of the key risks linked with excessive vitamin A is decreased bone mineral density. Weaker bones mean higher chances of falls and fractures, and since the legs carry most of the body's weight, they are the most impacted. Chronic overuse of vitamin A can interfere with vitamin D, which is needed for strong bones and muscles, leading to an imbalance that increases the likelihood of leg weakness and pain. In addition to bone loss, high vitamin A levels can cause muscle pain, stiffness, and fatigue, making everyday tasks like walking, standing, or climbing stairs much harder. Older adults may unknowingly exceed safe levels through multivitamins, fortified foods, or separate supplements. The recommended daily amount for older adults is around 700 to 900 micrograms of retinol activity equivalents, yet some supplements provide much more than that. It is important to check all sources of vitamin A, including liver products and cod liver oil, which are very rich in this vitamin. To avoid leg weakness and protect mobility, it is best to avoid high-dose vitamin A supplements and to get regular blood tests when using long-term supplements. Always consult a doctor before changing any vitamin routine. 2. Vitamin D, excess or deficiency. Vitamin D plays a major role in keeping bones strong and muscles healthy, but when you have too little or too much, your legs can suffer. After the age of 60, the body becomes less efficient at producing vitamin D from sunlight, and the skin also thins, reducing natural synthesis. A deficiency in vitamin D can lead to weak leg muscles, unstable balance, and a higher risk of falling. This happens because vitamin D is crucial for muscle contraction and nerve function, both of which are necessary for walking, standing, and lifting. When levels drop too low, the muscles, especially in the thighs and calves, may feel weak, sore, or tired, even after light activity. In addition, vitamin D deficiency reduces calcium absorption in the bones, making them brittle and more prone to fractures, especially in the hips and legs. Osteomalacia, a softening of the bones due to low vitamin D, can also cause dull aching pain in the legs and lower back. On the other hand, taking too much vitamin D in supplement form can be just as harmful. High doses can lead to calcium buildup in the blood, which can cause cramps, nausea, confusion, and even kidney problems. Muscle stiffness, pain, and weakness are common symptoms when vitamin D levels are excessively high. Older adults are more at risk of both deficiency and overdose due to changes in diet, medication use, and reduced sun exposure. The recommended daily intake is usually around 600 to 800 IU, but some people take far more without checking blood levels. Blood tests can help keep vitamin D in the safe range, which is roughly 30 to 50 nanograms per milliliter. To keep your legs strong and pain-free, avoid guessing your needs. Instead, work with a health provider to find the right balance of vitamin D through sunlight, food, and supplements. 3. Vitamin B6, high doses. Vitamin B6, also known as pyridoxine, is important for brain function, red blood cell production, and nerve health. However, when taken in high doses over a long period, especially after the age of 60, it can lead to nerve damage that weakens the legs and affects coordination. This condition is known as sensory neuropathy. It can cause tingling, numbness, burning sensations, and loss of balance, particularly in the feet and legs. Although vitamin B6 is water-soluble, meaning the body usually removes the excess through urine, large doses from supplements can still build up and become toxic over time. Older adults are especially vulnerable to this because their bodies process vitamins more slowly, and they may be using multiple supplements that unknowingly contain B6. Many multivitamins, energy boosters, and fortified drinks include this vitamin in high amounts, often beyond the safe upper limit. The recommended daily intake for older adults is around 1.5 to 1.7 milligrams, but toxic effects have been reported in people taking more than 100 milligrams per day over several months. In some cases, people have taken mega doses believing it would boost energy or mood, only to develop nerve-related leg problems that take months or years to improve. Symptoms of B6 toxicity may start subtly, with light tingling or cramping in the legs, then progress to unsteadiness and weakness, making walking difficult. The damage often starts in the feet and works upward, affecting leg muscles and overall mobility. If caught early, stopping high-dose B6 can lead to slow recovery, but in severe cases, nerve damage can become permanent. To avoid these risks, it is best to get vitamin B6 from food sources like bananas, potatoes, and whole grains, and only use supplements under medical supervision, especially in older age. 4. Vitamin E, excessive amounts. Vitamin E is a powerful antioxidant that helps protect cells from damage, supports immune function, and maintains healthy skin and eyes. However, when taken in excessive amounts, especially after the age of 60, it may do more harm than good, particularly to the muscles and circulation in the legs. High doses of vitamin E can thin the blood, leading to increased bleeding risk, which may affect circulation and oxygen delivery to leg tissues. Poor circulation can cause leg cramps, weakness, cold feet, and a heavy feeling when walking or standing for long periods. Older adults often take vitamin E supplements hoping to reduce inflammation or prevent chronic diseases, but doses above the recommended 15 milligrams per day can build up in the body. Some supplements provide 400 to 1000 IU, which can be far more than what the body needs. At these levels, vitamin E can interfere with blood clotting by reducing the effect of vitamin K. This may increase the risk of bruising, internal bleeding, or slow healing after minor injuries, especially in the legs, which bear much of the body's weight and are more prone to injury in older adults. Too much vitamin E may also affect muscle performance. Some studies suggest that very high antioxidant levels can blunt the body's natural ability to respond to exercise stress, weakening muscle adaptation over time. This may result in slower recovery, lower strength gains, and fatigue in the leg muscles. In rare cases, chronic overdose has been linked to muscle pain and weakness, further complicating leg mobility. To stay safe, older adults should avoid high-dose vitamin E supplements unless prescribed. Instead, vitamin E can be obtained safely from foods like almonds, sunflower seeds, spinach, and avocados. Regular checkups and cautious supplement use are key to protecting leg health in later years. 5. Vitamin C, excessive supplementation. Vitamin C is widely known for its role in boosting the immune system, healing wounds, and protecting cells from oxidative stress. It is a water-soluble vitamin, which means the body usually excretes any extra amount through urine. However, when taken in very high doses, especially through supplements, vitamin C can create unwanted side effects that may weaken the legs, particularly in older adults. After the age of 60, the kidneys, joints, and muscles become more sensitive to imbalances caused by excessive nutrients, and too much vitamin C can cause harm rather than help. One of the most common risks of high-dose vitamin C is the formation of kidney stones. These stones can cause pain that radiates into the lower back and legs, and if left untreated, they may also lead to infections and impaired kidney function. In addition, large doses of vitamin C may trigger inflammation in the joints, especially in people prone to conditions like gout or arthritis. This can cause swelling, stiffness, and pain in the knees and ankles, reducing leg mobility and comfort. Some people take several grams of vitamin C daily, believing it will prevent illness or fight fatigue, but the recommended daily intake for older adults is only 75 to 90 milligrams. Doses above 2,000 milligrams can lead to nausea, cramps, diarrhea, and even worsen muscle soreness. Prolonged overuse can affect the body's ability to regulate iron, which may increase oxidative stress and weaken muscle tissues, including those in the legs. To protect leg strength and overall health, it is best to rely on natural sources of vitamin C like citrus fruits, bell peppers, strawberries, and broccoli. Supplements should only be used if advised by a health professional, especially in older age when the body's needs and tolerances are more delicate. 6. Vitamin K deficiency. Vitamin K is essential for blood clotting and bone health. As people age, especially past 60, a deficiency in this vitamin can contribute to serious problems in the legs. One of the primary functions of vitamin K is to regulate calcium in the body, directing it into the bones and preventing it from settling in soft tissues. When vitamin K is low, calcium can accumulate in the blood vessels, leading to stiffness, reduced circulation, and eventual weakening of leg muscles. Poor blood flow means less oxygen and nutrients reach the legs, which can lead to fatigue, cramps, and pain when walking. Vitamin K also works with vitamin D to strengthen bones, and without enough of it, bones become more fragile and prone to fractures. The legs, being the body's main support, bear the greatest risk. A deficiency in vitamin K can increase the risk of osteoporosis, especially in older adults, which leads to weak, brittle bones in the hips and legs. Additionally, low vitamin K levels can cause tiny bleeds in the muscles and joints, creating swelling and pain in the knees, thighs, and calves. Older adults may become deficient due to poor diet, use of blood thinners, or digestive conditions that block absorption. Antibiotics can also interfere with vitamin K production in the gut. Symptoms may go unnoticed until serious issues like leg pain, bruising, or bone fractures appear. Leafy greens such as kale, spinach, and broccoli are rich in vitamin K and should be included in the diet regularly. To maintain strong legs and healthy circulation, vitamin K should not be overlooked. It is best to consult a healthcare provider before using supplements, especially if taking blood-thinning medications, as changes in vitamin K can affect their performance and cause complications in leg health. 7. Folic acid oversupplementation. Folic acid is the synthetic form of folate, a B vitamin important for cell growth, red blood cell production, and nervous system function. While essential in small amounts, taking too much folic acid, especially through supplements or fortified foods, can lead to hidden health problems in people over 60. One of the major risks is that excessive folic acid can mask a vitamin B12 deficiency, a condition that becomes more common with age. When B12 levels drop but go unnoticed due to high folic acid intake, nerve damage can silently develop and worsen over time. This nerve damage often affects the legs first. Symptoms may include numbness, tingling, burning, or a feeling of heaviness in the legs. Muscle weakness and poor coordination can follow, making walking and standing difficult. These effects are particularly dangerous for older adults, as they increase the risk of falls, injury, and loss of independence. Folic acid is commonly added to cereals, breads, and energy bars. In addition, many seniors take multivitamins or B-complex pills that contain high levels of folic acid. Although the recommended daily intake is about 400 micrograms, some supplements provide up to 1,000 micrograms or more, especially if taken alongside fortified foods. This can easily exceed the body's needs. Folic acid itself does not harm the nerves, but when it hides a serious B12 deficiency, it delays diagnosis and treatment. This delay can lead to permanent nerve damage, especially in the spine and legs. To prevent this, older adults should avoid high-dose folic acid unless prescribed, and always check vitamin B12 levels regularly. Eating natural sources of folate like leafy greens, legumes, and citrus fruits is usually safe and beneficial. Careful monitoring of supplement intake helps protect the nervous system and maintain strong, pain-free legs. 8. Vitamin B12 deficiency. Vitamin B12 is vital for nerve function, red blood cell formation, and brain health. As people age, the risk of B12 deficiency increases due to reduced stomach acid and less efficient absorption. A lack of vitamin B12 can have serious consequences, especially for the legs. The most common issue is peripheral neuropathy, a condition where the nerves in the legs and feet become damaged. This causes numbness, tingling, burning sensations, and muscle weakness. Older adults may not notice the symptoms right away, but over time, walking becomes difficult, and balance worsens. This can lead to falls and a reduced ability to perform daily tasks. In severe cases, long-term B12 deficiency can cause permanent nerve damage. Muscle coordination in the legs also suffers, and some people develop a shuffling walk or find it hard to lift their feet. The deficiency can be caused by poor diet, digestive issues, or medications like proton pump inhibitors and metformin. It is especially common in people who follow vegetarian or vegan diets without B12 supplementation, as this vitamin is mostly found in animal products. The recommended intake for older adults is around 2.4 micrograms per day, but due to poor absorption, many require higher doses or B12 injections. Symptoms often mimic other age-related issues, which is why B12 testing is important. Early detection and treatment with supplements or injections can reverse nerve damage and restore leg function. Foods rich in B12 include meat, eggs, fish, and fortified cereals. Maintaining healthy B12 levels is one of the best ways to protect your legs from weakness, numbness, and loss of mobility. If you experience unexplained leg symptoms, ask your doctor to check your B12 status. Prompt treatment can make a big difference in keeping your legs strong and steady. 9. Niacin, vitamin B3 in excess. Niacin, also known as vitamin B3, helps convert food into energy and supports the health of the skin, digestive system, and nervous system. While niacin is important, taking too much, especially in supplement form, can cause uncomfortable and sometimes harmful side effects, particularly in older adults. One of the most common side effects of excess niacin is flushing, which includes redness, warmth, and tingling in the face, neck, and even the legs. In larger doses, usually over 500 milligrams a day, niacin can cause muscle pain, joint stiffness, and leg cramps. These symptoms can interfere with daily movement and reduce comfort when walking or exercising. Older adults may be more sensitive to these effects because their bodies process nutrients differently, and they are often on multiple medications that may interact with niacin. Some people take high doses of niacin to manage cholesterol, but these levels should only be used under strict medical supervision. In regulated high-dose niacin can lead to liver damage, fatigue, and worsening of conditions like gout, which affects the joints and can cause painful inflammation in the legs and feet. At very high levels, niacin may also affect nerve function, leading to a burning or pins and needles sensation in the legs. Over time, this discomfort can limit mobility and increase the risk of falls or injury. The best way to get niacin safely is through food sources such as poultry, fish, peanuts, and whole grains. The recommended daily intake for older adults is about 14 to 16 milligrams. Before taking niacin supplements for any reason, it's important to consult a healthcare provider. Keeping niacin intake within safe limits protects the muscles and nerves in your legs, ensuring that they remain strong, flexible, and pain-free in your later years. 10. Multivitamin overuse. Multivitamins are popular among older adults who want to support their health, but taking too many or using high-dose formulas without guidance can do more harm than good, especially for leg strength. When multiple vitamins are consumed in excess, they can create imbalances that affect muscles, nerves, and circulation. For example, too much vitamin A can weaken bones, too much B6 can damage nerves, and excess vitamin D can lead to calcium buildup in soft tissues. Older adults are especially at risk because they often take multivitamins alongside individual supplements, unaware that they are doubling or tripling their intake. This can result in symptoms like leg cramps, numbness, tingling, or general weakness. Some high-dose products contain megadoses far beyond the body's needs, which over time can strain the liver and kidneys, reduce nerve sensitivity, and impair muscle coordination. Legs are especially vulnerable because they bear the body's weight and require healthy circulation, nerve signals, and muscle strength to function properly. Imbalances caused by multivitamin overuse can disrupt these systems and lead to fatigue, stiffness, or difficulty walking. It is also important to remember that certain vitamins interact with each other. For instance, too much folic acid can mask B12 deficiency, while too much vitamin E can interfere with vitamin K. These hidden interactions can quietly damage leg health if not monitored. The safest approach is to tailor supplement use based on individual needs, blood test results, and medical advice. Most nutrients can be obtained from a balanced diet, and supplements should be used only to fill specific gaps. Using multivitamins wisely protects the strength, balance, and flexibility of your legs, helping you stay mobile and independent as you age. In conclusion, maintaining leg strength and mobility as we age is a critical factor in preserving independence and quality of life. While vitamins play an essential role in overall health, it's important to recognize that certain vitamins, when taken in excess or when deficient, can negatively impact leg function and strength, particularly in older adults. Understanding the balance of vitamins like A, D, B6, E, C, K, B12, folic acid, niacin, and the risks associated with multivitamin overuse can help prevent unnecessary leg weakness, cramps, and nerve damage. A deficiency or excess of any of these vitamins can lead to a wide range of symptoms, from muscle weakness and pain to nerve damage and bone fractures. For example, excessive vitamin A and D can weaken bones and muscles, while a lack of vitamin B12 or D can cause nerve-related leg problems, including numbness, tingling, and difficulty walking. Similarly, excessive vitamin E and C can interfere with circulation and muscle function, and over-supplementing with folic acid can mask vitamin B12 deficiency, leading to further complications. Multivitamin overuse compounds these risks, potentially causing harmful imbalances that affect mobility and strength. The key to preventing these issues is ensuring a well-balanced intake of vitamins, either through a nutritious diet or, when necessary, with carefully monitored supplementation. Always consult a healthcare professional before starting any new vitamin regimen, especially if you are over 60 or have pre-existing conditions. With proper understanding, you can avoid the pitfalls of excessive supplementation and ensure that your legs stay strong, flexible, and ready to support you as you age. By staying informed and being mindful of your vitamin intake, you can protect your leg health, reduce the risk of injury, and continue to enjoy an active, independent lifestyle for many years to come.